Welcome back to Midnight Med. This video is on diuretics. We are going to look at the three main classes of diuretics, the indications for these specific drugs, so why you would give a patient one diuretic over another, contraindications, so absolutely reasons why you cannot give diuretics to a patient, and then we'll look at some of the mechanisms of actions and side effects, and for the more serious side effects, how to monitor to make sure they don't get too serious and outweigh possible benefits. So the first class is loop diuretics such as furosemide. Usually they're used in urgent diuresis. This does not have to be an emergency, just when the fluid needs to be quickly removed. For example, in hospital, when patients are fluid overloaded for whatever reason, furosemide can often be prescribed. However, it's not for long-term use, so you would rarely discharge patients with furosemide unless they have refractory hypertension and chronic kidney disease. So what that means is you've tried all the other antihypertensives and they haven't worked, but fusi works, so you use it. Now, mechanism of action, we have this nice diagram of the kidney, of the glomerulus, and the different parts of the filtration, which we're going to refer to. So loop diuretics affect the loop of Henle, in this case the thick ascending loop of Henle, specifically the sodium-potassium chloride core transporter. Side effects are important to monitor, so electrolyte derangements, as you can imagine, because you're pissing more, you're losing more fluid, you're going to also lose electrolytes. So you'll have hyponatremia, hypokalemia, hypomagnesemia, as well as hypocalcemia. From a metabolic perspective, however, you're losing fluid, but you're not really losing uric acid. So uric acid becomes more concentrated and you end up with hyperuricemia. Now, this is an important consideration if you're prescribing it to a patient with gout, because it can worsen gout because gouts increase uric acid. Hypokalemic alkalosis is also another important point. So as you lose sodium, you're also losing chloride. However, chloride's a negative ion. The kidney doesn't want to lose too much negative stuff, so it's going to increase its bicarb. Bicarb is basic, so it's going to result in alkalosis, hence hypochloremic alkalosis due to the increased bicarb. Other side effects, hypotension, so it's an antihypertensive. You give too much, they end up hypotensive. AKI with all the fluid and electrolyte derangements. And interestingly, you can also end up with ototoxicity, so hearing loss. The next common diuretic that's used is potassium-sparing diuretics, for example, spironolactone. You would use them in heart failure with reduced ejection fraction. So what this means is that heart failure is when the heart fails to pump properly. Now, this can be a systolic or ejection problem, or it can be a filling diastolic problem. In this case, we're talking about systolic, so contraction ejection problem, where the heart isn't contracting enough. And in that case, you can give spironolactone. Contraindications, however, include renal failure, Addison's disease, or pregnancy. Now, Addison's disease being contraindication is related to its mechanism of action. So it's an aldosterone antagonist, as shown in the diagram, and it acts in the collecting duct. And Addison's disease is insufficiency of aldosterone. So if you already have low aldosterone, you don't want to further antagonize it, because then you're really going to drop your blood pressure, go into an adrenal crisis. Side effects are similarly, you have hyponatremia, hypochloremia. But in this case, because you're sparing the potassium, you're not losing it. You're actually going to end up with hyperkalemia. From a metabolic perspective, you have metabolic acidosis, because you have increased potassium hydrogen channel. The hydrogen has to go somewhere. Hydrogen is acidic, metabolic acidosis. From an endocrine perspective, they can often end up with impotence or gynecomastia. Gynecomastia is an important point because you may also give it to patients with liver failure. Liver failure, they're also at increased of gynecomastia anyway, so patients can commonly end up with gynecomastia. Thiazides are the final class we'll talk about. For example, hydrochlorothiazide. Indication, we're thinking hypertension if they're over 65, as well as chronic edema. Contraindications include pregnancy and cirrhosis, and the mechanism of action, As you can see in the diagram, it's acting on the distal convoluted tubule. It inhibits the sodium chloride co-transporter. Side effects: electrolyte derangement, as with most things, so low potassium, low sodium, low magnesium, but in this case high calcium. Metabolic as well, it leads to hyperuricemia, so important the patient's gout to not give it, as well as hypochloremic alkalosis by the same mechanism that we talked about for loop diuretics. Other considerations are hyperglycemia, so be careful with diabetic patients, as well as ototoxicity, so you're going to have hearing problems. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.